Dun, dun. All right, hello everyone. This is Trevina Jefferson, Mind and Heart and Biz. We are with Dr. Maria D. Flowers today, part of the GIFT Mission Initiative of Trepson Operations and HR Consulting. So we like to talk with people who operate purpose-driven businesses, who also operate with integrity in the community. So, Dr. Flowers, could you please tell us a little bit about yourself and what you do?
Sure. So first of all, thank you, Trevina, for having me here. I greatly appreciate it and the work that you're doing. My name is Dr. Maria Flowers. I am a quality healthcare strategist, and what I do is I work in health equity and patient safety. I have a health equity and patient safety consulting firm called Maria D. Flowers and Associates. And we work with hospitals and healthcare organizations to help them with their patient safety and health equity strategy. We also do health equity impact assessments, and we do trainings and we do courses and speaking engagements as well. And I'm also the founder of Safer Healthcare for All, which is a nonprofit organization that focuses on patient advocacy. It's self-advocacy. So we work on connecting patients with organizations to empower them and empower their voice in the healthcare setting to advocate for their own safe and equitable care.
All right. Well, thank you for that. Because it kind of gave me a bit of both sides. I had wondered a little bit about how that worked in the healthcare system itself. And it sounds like you're able to do some assessment type work with them. Is that right? And as well as trainings.
So are you talking about on the
On the
consulting?
healthcare system side. So like when you're helping healthcare professionals. Yeah.
Yeah. So one of the main things that we do now, there was some recent legislation that came about in the state of New York called the Health Equity Impact Assessment. And basically what that is for hospitals, well, all medical facilities, but mainly hospitals, when they are applying for a certificate of need, which is usually an application that they have to submit to the public health department when they want to do a merger and acquisition, or if they need to do a capital construction project, take away services, add services. They have to fill out this application. Well, what the state of New York has done is are now requiring these facilities to do a health equity impact assessment. So they want to know, hey, does this project that you're doing, how is it going to impact the underserved people and populations of the communities that you serve? And so my organization steps in and does those assessments with hospitals and other medical facilities in the state of New York.
All right. Yeah, that's pretty big work, and I can see how that could expand greatly to other states as well, as we are trying to do more to meet the Constitution and equity. So on the flip side, with the nonprofit, you talked a bit about. I know you were doing some town halls, and I'd like to know, like, what are some of the major topics or the major challenges that you find that people don't know about health when they're addressing it for themselves?
Well, the main thing that I find, especially within the communities of African Americans and other minoritized people, is that we don't realize our own agency when it comes to healthcare. So a lot of us, especially older, the older generation, it's like, oh, well, my doctor told me to do this, or my doctor told me to take this medication, or my doctor said this. And we don't really ask the questions to say, okay, well, all right, well, you told me to take this. Well, okay, well, is there another alternative medicine that I can take? Or do I have to have this surgery? Is there some other option that I can take? Or I got my lab work back. Did you look at this? And do I need to take a medication? We need to be more active partners in our own healthcare. The data that the physicians are taking, when they're looking at your vital signs, when they're taking your labs, if they do an x-ray or whatever, that's just one snapshot of what's going on with you. You really need to partner with your physicians to give them some more input of things that are going on so that they can help treat the whole of you. So that is something that in our town hall events, when we connect with the community, that we help inform the people in the community about their ability to be able to do that.
Mm. Yeah, so you get kind of a more holistic view. Um, is there anything that stands out when you do also some of these town halls, like questions coming from the audience?
The main thing that is overwhelming that I find, and just to bring a little more context, the town hall events that we have, the Health Equity SOS,
Mhm.
which is health equity, sharing our story, saving ourselves, is our signature town hall event that we have. We had our inaugural event in California, where we connect with the community. We go into either a church, or we have some upcoming events where we're going into housing development. Um, and we bring in organizations that have resources, information, and we give information to the people there where they are. We meet them where they are. And then we open it up as a town hall and answer their questions that they may not feel comfortable asking in a medical setting. We open it up and allow them to ask those questions there. So the main question that I get that always it's kind of a recurring thing, but it's the stories. It's the stories that people share of they're always having these experiences of implicit bias or discrimination within the healthcare setting, and they don't know who to talk to. They don't know what to say. They don't know how to report it, or they've had some adverse event happen and they're unsure if that happened because of their color or because they are underserved. They may not be um, wealthy, so they feel that it happened because they feel that they can't afford the funds for their services. And so those are it's not really a question, but it's more of a cry or a call that we hear constantly when we're going to these events, and it's a reoccurring theme that I hear all the time.
Yeah, what to do. Um, and I think for me, what comes most to mind is just, and I know this is one of your expertise topics as well, um, but I know I've had some incidents just around like maternity care, like the lack of what I didn't know becoming a mother. And then at a certain age that's older, than some others, like what kind of effects did I have? My health background and stuff, but those were not really questions that anyone cared about until maybe I get past 12, or in some cases I've heard 24 weeks before I can even see a doctor.
Mhm.
And that to me, I think is kind of disparaging. Like what if you noted concerning like African American women and maternal care?
Well, obviously, that's a huge topic right now. Our current president and administration has highlighted that. Thankfully, has highlighted that because African American women are dying at an alarming rate because of the maternal mortality issues. And I'll just say, women in general in the United States are dying at an alarming rate, which is unfortunate because we're such a wealthy nation, a first world country, and we're dying at the rates of third world countries, regardless of race.
Mhm.
So the African American women in this country that are dying at even, exponentially worse than others because of um the lack of care. And I could go on and on, but I deal a lot in root causes because I deal with patient safety and patient safety science. But I'll just say this. Um, on the front end, immediately, what you can do as far as, someone who's expecting or a new mom, if you're managing your care and you're wanting to get immediate assistance, you've got to use your voice. You have to use your voice. The squeaky wheel gets the oil. You've got to use your voice. So you've got to speak up. speak up to your providers, speak up to the hospital, the facility that you're going to, speak up to your insurer. Um, Speak up to your employer for your coverage if there's something that's not being covered. Because a lot of people don't know. They say, oh, my insurance doesn't cover it. Well, sometimes it's not the insurance. Sometimes it's your employer that's restricting certain coverage from your insurance. So there's a lot of things at play that contribute to this. It's a systematic and systemic issue that is going on with maternal health. But the very first thing that you can do is use your voice individually in your situation and also collectively. One thing that we have at our disposal that our ancestors didn't have is we have the internet. The internet and social media sometimes is some people think it's a bad thing, and it can be bad, but it can be used for good. And so there are villages that can be created on social media and with technology. There's an app that came out called Earth, IRTH app. Um, it's called Earth app B because they take away the bias, but IRTH app, and it's a resource for women of color to find providers that are maternal health friendly, that other women of color have went to. It's kind of like a Yelp that other women of color have went to and had positive experiences. That's where we can use our collective voice to say, hey, don't go here, go here. And those are just little things that we can do on the front end to save ourselves from this maternal health issue until our government puts some better guardrails in place for accountability for organizations.
Yeah, absolutely. Would you mind dropping the name of, I think it's called Earth app, you said?
Yeah.
To the comment there?
Yeah.
How do
I do that?
While you're doing that.
I can't figure out how to do it in real time, but what I can do is after the event, I can find it and I can make sure that I put it in the comments.
Okay. No, that's fine. You called it Earth.
IRTH app. IRTH.
Oh, okay. Yeah. IRTH. And then app?
Mm-hmm. The Earth app. Yeah. I think if you just go to earthapp.com, you should be able to find it.
Okay. Right. IRTH app.com. Okay, I'll have to check that out. So this is like what you're doing now, but I guess kind of the question I have is what brought you here? What brought you into health and wanting to address these types of challenges?
Sure. The short story is I've been in the healthcare industry all my life. My mom worked in healthcare, so that's how I got into healthcare. And pretty much my whole working career, I worked in the healthcare field. So I've seen a lot of change in healthcare, technology-wise, policy-wise, that I've seen over really, if you count when I first started working in healthcare when I was a teenager, the over 30 years that I've worked in healthcare, I've seen a lot of different things, and I've seen it at a lot of different levels. And then more recently, working in patient safety and risk, I really got to get under the covers, so to speak, and I saw some things that I just did not like. And at the time, I was working on my doctorate, and I was experiencing some things in corporate healthcare, and that just really troubled me. And I felt some things need to be done for the future of healthcare. And so this is my little part of what I'm trying to do. I look at the work that I do in my consulting as the work that I can do from the top down in helping organizations do the right thing as far as patients are concerned. And then the work that I do in the nonprofit, I look at that from work from the bottom up in helping patients. And so hopefully somewhere with everything, the work will meet in the middle.
Yeah, I think so now I'm a veteran. So one of the things that I saw in the veterans hospital is there is patient advocates. Do you find that to be true in regular hospitals, as well? Actual offices or places people can contact if they're not getting anywhere with like the nurse line or trying to get stuff solved.
Yes, definitely. So a lot of people don't know this, but there are patient advocacy offices, there are patient navigator offices, sometimes they're called patient navigators. Um, Outside of the VA hospital system,
Mhm.
patient advocates or patient navigators are usually disease specific. So
Mm,
normally if there's some type of illness that you're navigating, that you work with that patient navigator office, and that person comes alongside to you to help you coordinate a myriad of things, whether it's your different care providers. It could also be social services that you need to help manage that disease specific. There are some hospitals that may have just a general patient advocate or patient advocacy department. They may work hand in hand with the social services department as well. But those three things: patient navigator, patient advocacy, and social work in some form will exist in every hospital that you're in. And in some outpatient settings, there
really?
may be a department that outpatient setting may roll up to as well. So all you have to do is know one and then ask, right? So
Mm.
if there's some information that you need or you have a question, just ask, do you have a patient advocacy or navigator department that I can speak with? Or is there a social services department that I can speak with about something? And just ask. Um, those people are people that will come alongside you and help you understand what information is available as you navigate your whatever your health situation is. Um,
Patient advocate. What was the other one you called it?
Navigator, patient navigator, and
Navigator.
also social services or social work. Um, Also, if you're experiencing an issue, so say something happened, um, you got the wrong medication or you felt something wrong happen to you in the healthcare setting. First, I would say document. Make sure you document whatever you can, but then reach out to that. There should be a patient safety department within the hospital that you can speak to. Um, Hopefully, they work with you to mitigate that issue. If not, then there are level ups that you can go. You can go to the Joint Commission. If that hospital is accredited, should be accredited by the Joint Commission, you go to the Joint Commission and you can do an inquiry there or report that there. You can go to there's sometimes there's patient safety offices within the state that you can reach out to, and you can report that information there. So you don't have to stop in one spot, but you want to exhaust all these resources. A lot of times people say, "Oh, I'm just gonna, so and so did this. I'm just gonna sue. I'm just gonna sue." Well, sometimes it's a little bit more difficult than that. You
That's
want
expensive
to
and challenging.
yeah, but you want to make sure that you did your due diligence on your end before you get there. And you want to work with the hospital. You want to work with the the people that are taking care of you. You want to think of it like, you're going to a restaurant and they do your steak, you asked for, medium well and they did, medium rare. Well, you want to work,
Right.
you let them have the opportunity to correct it first. So you want to look at it in that way.
Okay. Go back to the state side. So like, I mean, I know about consumer care. If something happens to my car, that's big. Everybody has a car. There's an issue. I didn't buy it right. The thing blew up, whatever. Um, but to know that, after you get to the hospital, if they're not able to resolve it, a lot of times they'll, if I've had to talk to a hospital, they'll be able to stop there. But if that doesn't work, if that wasn't enough, I don't think I was really aware of like there's also a state overseer, like there is like over automobiles and other things that we buy. So what was the name of it again? I'm sorry.
Yes, there are other, and I just want to go back just 1 second to clarify something that I said. I don't want to in any way minimize anyone's health care or health treatment to going to a restaurant. I don't want to minimize that at all. Um, because I do understand that whatever someone may be going through, obviously to them is not as trivial as ordering a steak or getting a meal somewhere. For someone, this may be their first major encounter with a hospital. So they may be very nervous. Their trust level may be very low with this situation. So I want to just say that I completely understand that, and I don't want to trivialize that at all. So with that being said, yes, there are other agencies that you can reach out to. But you want to follow that. You want to try to follow that chain of
The
command.
chain.
You want to try to follow that chain of command first. If you reach out to the hospital and you're not getting an answer, then you want to escalate to you could escalate to Joint Commission. Most hospitals are accredited through a Joint Commission, should be. And there should be, most hospitals will have who they're accredited by, what their oversight is. And so that would also tell you who you can reach out to outside of the hospital as well. And then that would also tell you on your state level, because different states are going to have a different chain of command of who you can reach out to. But there are patient safety organizations that you can reach out to within the state that you can file a complaint to that can maybe help you escalate your situation.
No, I think that's really helpful. I think you got that there. Because that's right. On just about every physical institution that we have in any state has some sort of authority over them in order to be having that physical establishment, whether it's, DMV or, the accrediting body for a university, accrediting body for, a hospital. And just, being able to see, okay, so there should be advocates right here, where I'm at. If I can't get those, I'm looking for a supervisor. If that doesn't work, then I might have to start looking, outside. But I think it's just a lot of times you go in there and it's this big place and it feels like this is it. The first person in line told me no, and maybe they're just following directions, but that's where I stopped. And so I think it's important to know that there's a chain. And so I think that work that you do, having these town halls and really helping to inform people that there are other options and that they need to try to be a part of these things, because we're all going to have some health challenges at some point in life. No one's going to be healthy forever. And and getting through to the best health that you can get. How do you think, and I noticed you got pink and green back there, so you're AKA, right?
Yes, I am.
Yeah, so my mom was too when she was in college.
Mhm.
Do you feel like you did any work with within your AKA chapter, back in school, that sort of put more of a service initiative on you, or do you feel like you were always into service even prior?
Well, first I'll share. I joined Alpha Kappa Alpha Sorority Incorporated as a graduate chapter member of the Upsilon Lambda Omega chapter in DeSoto, Texas. So I joined after I graduated from college. When I was in college, I was involved in the National Council of Negro Women. I was part of the chartering chapter at Tuskegee University, and so. As far as service is concerned, where in my life I started doing that, I grew up in the church. And so I just and when you asked me that, it made me think about what I think of, we just always just did stuff,
Yeah.
um, growing up in church, it was something that you were doing. It was always something to be done. And so my dad, who was a pastor, it was always something he was doing. My mom, it was always something that she was doing. And so I just grew up always being involved in something, whether it was service, giving back, volunteering in an organization, either a professional organization or a service organization. But I to be honest, I can't think of a time when I wasn't. I was always with my mom or my dad doing something.
Wow. Oh, it's amazing. Um, just want to thank you for your time coming on here today, and helping us through some things, because it's important, just to be able to see how can you get help for yourself and for someone else, because a lot of times younger people are taking care of their parents. They're trying to figure out the system because now they can't take care of themselves. And there are resources, out there to help them. You're not just doing everything, by yourself. And even so, like, even regardless of the age, there's always something. Every part of our life, there's something, especially for women, because you might be having a child, you might have, it could be diabetes, or it could be anything. So this is such a great thing, that you're doing. Do you have? I did put some information about your contact information. Is there a way to contact you? I know first there's one way for if you're doing training for like hospitals and health facilities, as well. You want to start with that?
Yeah, sure. So for any healthcare consulting needs, I think I saw in the chat, mariadflowers.com. Just reach out there, or info@mariadflowers.com. You can reach me there. If you are interested in the work that we're doing on the nonprofit side with Safer Healthcare for All, saferhealthcareforall.com. All spelled out, saferhealthcareforall.com. And if you feel led to give to help fund one of our upcoming town hall events, we're currently in the process of planning for Nashville, Tulsa, and New Orleans. Please, it's Safer Healthcare for All.
Okay, I'm missing something. So it should be Safer
Healthcare
Healthcare, and then spell out
for all.
Okay. Hold on. Okay, let's try that one.
Yeah.
And then,
yeah.
Does this look right?
Mm-hmm. Yep. That's it.
Okay.
Yeah. So
saferhealthcareforall.com. And that's helping like the consumer side understand, or go, and then get more information from your town halls, so that a lot of folks can get information at once. And you said there's one coming up soon?
We're in the planning process right now. So we work with local organizations. So right now we're looking to identify a local organization that's willing to host us in the Tulsa area. So if you know anyone, if you're in Tulsa, if you know anyone in Tulsa, please reach out to me. Let me know. We'd love to connect with you to see how we can help the people of Tulsa, Oklahoma. I am in the process of, I've not solidified a date, but we're in the process of planning one also for Nashville. And New Orleans, I'm doing in conjunction with another organization. So I am kind of partnering with them. So their information will be lead on that. But any funds that are donated to Safer Healthcare for All go directly to our town hall events and to the advocacy work that we do with our patients.
Very good. Well, thank you so much, Dr. Maria Flowers, for joining us today on health equity, and giving us all of that insight. I think that'll be all for now. Thanks so much.
Thank you for having me, Trevina. I really appreciate it.
Thank you.